Welcome back, everybody. Seems like everything's got a month these days. How about vascular disease? It has a month too. National Vascular Disease Month is in September.
Yes, Dr. Todd Bengtson is here to share some of the common concerns of vascular disease. Thank you for coming.
Thank you, Bob.
Nice to have
Thanks for
you here.
having me.
Now, you were saying earlier it was asymptomatic, but there are a few signs to watch out for, right?
There are signs and symptoms. Peripheral arterial disease, it really just relates to narrowing of an artery anywhere in your body. And the three areas that I wanted to really concentrate on today were the carotid artery, which provides blood supply to your brain, and the bad complication with a blockage in your carotid artery is stroke. Peripheral arterial disease also affects the abdominal aorta, and the common problem we see there is aneurysms. And then blockages in leg arteries are very common, and the symptoms we see there are limitations in exercise due to pain in the legs, and then with worsening atherosclerosis, actually wounds on the toes and feet.
What are other signs other than you having a stroke, other than you having some severe pain in your leg? Are there any things that lead up to this going, gee, maybe there's maybe something's not right here?
There's really not. Up to 10 million Americans suffer from peripheral arterial disease, and the majority of those people are asymptomatic. If you look at people greater than the age of 65, 10 to 20% of those people will have peripheral arterial disease. They will have arterial narrowing. A lot of these blockages are found with imaging studies for other reasons, atypical pains, workups for cancers, gallstones, that type of thing. But I think it's also important that people realize there's a lot of screening programs that are available. If people look at their community centers and churches, you'll often see vascular screenings that are either free or offered for a pretty nominal price, and I think it's important that people take advantage of those programs.
In terms of prevention, what do you usually tell your patients? Diet and exercise, or is it just so much more than that?
There's a lot to vascular disease. The 5 main risk factors that we talk about are smoking. So if someone is smoking, they should stop. That's a major factor for peripheral arterial disease. Hypertension, diabetes, and hypercholesterolemia are 3 other factors that are controllable by the patient and their physician. Control your blood pressure, control your diabetes, control your cholesterol levels. Part of atherosclerosis is genetic, and we just can't do much about that right now. But if you have a family history of peripheral arterial disease, it should certainly awaken your awareness that you could have that problem yourself.
And National Vascular Disease, anytime you're trying to highlight something like this, obviously we try and find cures or treatments for this. Obviously, research is big in this field, just like anything else.
Yes, sir. The research really is towards the genetic component of it, I believe. And also drug therapies. There have been great technological advances in the way we can treat the arteries themselves. As vascular surgeons, we still offer traditional bypass type surgery and endarterectomy surgery where we actually clean the artery out. But we've made good advances in balloon angioplasty and stenting and being able to open an artery with what's called an atherectomy catheter, which is essentially a roto-rooter, a spinning blade that will open the artery. So there's research and development and technological advances to actually mechanically treat the disease, but there's also a lot of research going into the genetics and the medical treatment of peripheral arterial disease.
And the first step for people watching at home thinking, I might have something, I hope I don't, is just maybe a scan?
I think the first step would be to find a screening program, and the Trinity Mother Frances Vascular Institute does offer screening through our office, so you'd be welcome to contact us through Trinity Mother Frances, and we can arrange screening, but also Lifeline screening could be looked up online. They offer a lot of local screening, as well as local churches and community centers.
That's the way to go. Knowledge is power, guys. It's best to know if you have it, how to deal with it, and see your doctor. Doctor, thanks for coming in.
I appreciate it.
Thank you for your time.
Nice to have you with us.
You guys have a good day.
Learn more about another culture with the upcoming